What we want is a medical workforce that reflects our patient base in some way. I think that patients should be able to walk into a room and feel like they have a clinician that understands them. Hi, I'm Ashna. I'm a doctor training in psychiatry and the chair of the Young Branch of the Medical Women's International Association. I'm also an alumni of UNSW Medicine.
Hi, I'm Sean, and I'm currently studying medicine at UNSW as a third-year student. I'm also the General Practice Student Network National Chair, and I host a podcast called Bedside Moments.
And today we'll be talking about healthcare for all. Sean, what drew you to medicine?
It's a nice combination of, being able to give back to the community, and it was also something that I was interested in learning. I thought that was very important, especially throughout high school. I found the sciences very enticing, found biology extremely captivating, and it was something that I saw that I could be continuously doing for a large part of my life, and that's what kind of drew me into the process of applying for med school.
Yeah, I mean, when I was in school, I think I was a fingers and lots of pies girly, and it was hard for me to narrow down what I specifically liked. And I realized the beauty of medicine was it was a lot of careers in one: teaching, law, medicine, that sort of people aspect as well. So I figured it was a broad enough field that I'd find something that I loved and be able to do a bit of everything at the same time. And I found that to be true of psychiatry as well. There's the neuroscience of the mind, which is fascinating. There's also that component of how we design our cities and how we live, and then working with people and the social justice aspect of ensuring equity of care. How do you think that we can use multimedia and online communication towards that goal for healthcare for all and improving equity?
I think it's a really important thing to kind of at least break down the barriers in communication between a medical student and also a physician. There's not a lot of opportunities to do that within the medicine program, but having a platform where you can hear how physicians are in their daily lives, the kind of families they have, the sports and hobbies that they do, and also just to talk candidly about their experience going through the medical system, going through the specialization system, and going through the pathway that most medical students are actively trying to pursue. It's a great thing to have so that medical students and also the general public have a better understanding of what their physician is going through, so there can be better communication and better dialogue between the two. What do you think about how we're currently choosing candidates for medicine, and how has your experience been going through that system?
Yeah, look, I think what we want is a medical workforce that reflects our patient base in some way. I think that patients should be able to walk into a room and feel like they have a clinician that understands them. And we all have a duty to understand issues that are more that are different to the world that we live in, but also we want our healthcare system to reflect our patient base. It's incumbent upon the profession, upon universities, to go out to people and explain to them why we want them to be a doctor and why they would be a fantastic doctor, and for us to recognize all the many things that people that are First Nations heritage, people of color, people of different genders and sexualities would be able to bring to make our workforce livelier and more inclusive. And it's on us to go out and tell those people that we need them rather than expecting them to kind of find us.
Yeah, that's a very, very fair point.
When you look at innovation in healthcare, what makes you the most excited for the career you're about to embark on?
I think the thing that makes me most excited is how AI is advancing. We've used AI for tons of things in detecting skin lesions, in providing better outcomes in radiology, for seeing microfractures in x-rays that would be invisible to the clinician's eye, to be able to detect anomalies inside large-scale data groups that would be almost impossible for a single human to sift through, even in a lifetime. And those are really exciting things, and I think it will very much change the way we go through and access healthcare.
Yeah, for sure. I think that AI affords us a lot of opportunity to make different parts of healthcare more accessible, to work towards that goal of healthcare for all. But on the same vein, something that I think about a lot is that when you're looking at a predictive model, it's predicting off the basis of data that we have, and the data that we have is gendered. The data that we have doesn't take into account people of different backgrounds, different ethnicities, and it's interesting to see how the role of healthcare is going to involve advocating to make sure that the data that goes into those models is inclusive and considers all of our patients, not just the ones that have been considered the historical norm.
One of the massive advancements, especially with the general practice sphere, but I think everywhere as well, is the advent of telehealth. Having on-call physicians and having physicians that can dial in is something that is so useful, and especially in rural communities where it's very hard to fly a doctor in, and often unrealistic to, it can provide healthcare in an area where ordinarily we would not be able to access, and it can provide specialist opinions in areas of the world where it will almost be impossible for a specialist to fly into as well. And it also unlocks the ability for multimodal team discussions in an online format where you can get data and you can get expertise and experience from all across the world, into almost one room essentially, to discuss a very complex case and advanced medicine. And I think that's really, really exciting.
It is really exciting, and I think actually through COVID we saw an exponential increase in the way that we utilize those technologies because we really needed to, and not just for rural and remote communities, but actually for people that have accessibility needs, for people who are working and can't get away to wait in a doctor's office in case they're running late for their appointment. Telehealth does offer accessibility in communities that can't access them, but also in our everyday life, just giving us more options as patients to access the care that we need.
Specifically in the field of psychiatry, what have you found to be some technological advances or just revolutionary ideas that have changed the way you've practiced?
So I think some of the things that I'm really excited about wouldn't be technological and they wouldn't even be revolutionary, but it's things like psychiatry's commitment to considering the whole person, that biopsychosocial approach, and looking at social factors, thinking about things like early intervention, not just as recognizing someone's psychosis early, but thinking about the way we structure our societies and how that cultivates wellness and well-being, or how it might hinder it. I think also the idea of how we can educate people so that they can live a better life, not just addressing illness, not just trying to seek cures, but helping people live better through things like sleep, through exercise, through their nutrition, because all of those things fuel our brain, and our brain is obviously where is that hub of emotions and feelings, and it's important to give our brain the best fuel. So those things are kind of bedrock foundations, but I think it's very exciting that as a field, it's something we're putting more towards the forefront. So Sean, how do you think about the concept of healthcare for all? What does that mean for you?
I think what healthcare for all means for me is equivalent access to healthcare for all people of any ethnicity, any race, any gender, and it providing them with the option of healthcare and the option of the best healthcare available to them. A major factor in what healthcare for all means for me is making a doctor's visit something that is not a scary experience, having people want to go to a doctor and ask them about the issues they're having, and for doctors to be able to access and provide the best care possible for that patient.
For me, I think it's designing our systems and our treatments, even considering our diagnostic paradigms through the lens of the complexity that our patients have, and ensuring that we're truly inclusive. We consider every part of the patient when we think about their healthcare outcomes and what they might need going forward.